My name is Dr. Misbah Khan. I am a cosmetic surgeon in private practice in Manhattan. I specialize in revision surgeries, particularly due to liposuction defects. Today I'm going to talk to you about a patient that I treated for CoolSculpting defects. CoolSculpting is a non-surgical, non-invasive technology that selectively targets fat by freezing it. Our patient over here had the procedure done about more than a year prior to coming in to see me, and I'm going to show you the way her defects were on her thighs. This is the way she looked in the front. As you can see, there's a deep indentation on one side and a protrusion, and with a significant asymmetry on the sizes of both thighs as well as the knees. If you look at her from the back, you could probably appreciate the asymmetry on the buttocks more, and then there's significant gluteal drop or the elongation of the buttocks as well. On the side view profile, this indentation becomes even more obvious, and the protrusion is right here. This is this area where the applicator for the CoolSculpting was applied. And the same thing is happening on the other side, but to a lesser degree. However, the defect is still there, and the protrusion is underneath it. Now, after I fixed the case, this is her picture before and after, 2 months out. So I was able to take care of all of this asymmetry over here, the bowing of the leg or the heaviness of the front of the thighs. I was able to bring that down, and the asymmetry in both the knees, and also a lot of the surface indentations, we were able to correct most of that. These are her pictures from the back. All of this indentation, the protrusion, and to some extent the gluteal drop, we were able to fix that as well. And then the back of her thighs came out looking nice and smooth. This is her side view profile. This side was not as bad as the other side. However, you can see that this indentation is significantly better. There is still some room for more fat grafting over here, for which we may consider doing another session in a few months, depending on whenever a patient is ready for that. But if provided it's a priority, and if it's not, then we can just let that go. This is her photo from the other side. As you can see, the deep defect is significantly better. We were able to fix pretty much most of it, and then small indentations are still there, but the heaviness of the front of the thighs got a lot better. So I hope you enjoyed this video. If you need further information on how this procedure was done, please feel free to watch my video on how to fix botched liposuction. Thank you.